Morning, everybody. Hi there, my name's David Sloman and I'm the Chief Executive of the Royal Free London NHS Foundation Trust, and I'm joined by my colleagues Dr. Robin Wolfson, Associate Medical Director, Caroline Clark, my Deputy and our Chief Finance Officer, and James Mountford, our Director of Quality. James is new to the school, so hasn't got the right uniform yet, but he will be catching up. In summary, our Vanguard bid proposes the establishment of the Royal Free London as a credentialised hospital group that is open for others to join. I won't tell you much about the Royal Free, but I will mention one or two things about the work that we've done recently in the space of acute care collaboration. Firstly, we are one of the founding members of UCLP Academic Health Sciences Centre and Network, and its predecessor organisational work around clinical networks. Is there anybody here from UCLP? Just a wave, just a wave. Secondly, we were in the first wave of buddying when we buddied with our colleagues in Basildon and Thurrock. Is there anybody here from Basildon and Thurrock? Hello, Claire. And thirdly, just over 12 months ago, we made the acquisition of Barnet and Chase Farm Hospitals to, in essence, immediately become a nascent chain or group. And what my colleagues are now going to share with you is some of the progress we've made over the course of those years in standardising clinical care, standardising financial variation, and adding real value to patients. We're going to start in the space that matters most, which is, of course, clinical services, and I'm going to ask Dr. Wolfson to talk a little bit about what we've done.
Cool. Thanks, David, much indeed. I'm going to talk to you about two areas of specialised medicine and one area of general medicine where we've made great progress over the last 12 months, particularly. First of all, I'm going to talk about urology. So at the Royal Free, we implemented a new care model for urology patients to reduce waiting times for new patients and to increase discharge follow-up. Following the acquisition of Barnet and Chase, we've rolled out that model to Barnet and Chase, and we've also centralised inpatient activity and complex urology surgery at the Royal Free site. And we've most importantly developed subspecialty interest for all the consultants in our patch. Renal cancer is a service that under the aegis of London Cancer, we now deliver at the Royal Free Hospital for North Central and North East London. Through intensive work with clinical stakeholders all over the sector, we have developed fantastic pathways that are now resulting in exemplary surgical outcomes and a FFT score of 98% recommendation, which is just great for our patients and our service. Over the last 10 years, we've developed a clinical network for nephrology patients. This network spans 5 NHS trusts in North London and 3 additional sites in order to optimise the delivery of patients to their treatment, delivery of treatment for their patients, for our patients. And we now have achieved and deliver top decile performance in dialysis, in vascular access, and in transplantation. Finally, with the acquisition of Barnet Chase Farm Hospitals, we took on another emergency site, and we've been working really hard to standardise performance across A&Es on both sites. We've managed to lift our performance for our target from 90% to 95% in the face of a 13% increase in attendees. Consistent with this, our FFT recommendation has risen from 80% to 86% across the patch, for which we and our staff are really, really proud. I'm going to pass over to Caroline, who's going to talk to you about clinical and non-clinical support services.
Thank you. So I'd like to describe some of the progress we've made to date in what you might call the middle office, so that's clinical support services, and the back office, which is corporate support services. I've got 3 examples. First of all, I'd like to tell you about pathology services. Last April, we set up a joint venture with a commercial supplier and another NHS organisation to supply pathology services to all our organisations. We've already got our first customer. Our transformation plans indicate that we'll take costs down by about 15% in the first 18 months and still give great performance to our front office, if you like, clinicians. So we're very proud of that and think it would be a great offer for anyone who joins the Royal Free Group. Secondly, I'd like to tell you about the work we've done on integrating our pharmacy services. We've been standardising prescribing practice across the new organisation since last year. And I can give you an example of, for example, where we've changed to single-dose banding for infliximab, and we've saved over £1 million in the last year. So again, something for us around standardising both clinical and operational management protocols and processes. Finally, I'd just like to talk about the corporate services, or back office, as Simon Stevens calls it. I'm a back office director. I'm not quite sure I approve of that title. We've centralised our core corporate functions, so that's finance, IT, HR, the administrative transactional functions, and we've reduced our headcount over the last year by about 25%. We think that we can do more. Again, as Northumbria said, putting that money back into frontline clinical services for patients. And we think, again, that would be a great thing we can bring to bear with our group model. Now, how are we going to do that and make it sustainable and roll it out across members of the Royal Free Group? James, our Director of Quality, is going to talk about that.
Thanks, Caroline. So, as we've been hearing this morning several times, to get the greatest benefits from a group, you've really got to get into the heart of how care is designed and delivered. And we're putting in place what we call the Royal Free Way of putting continuous improvement into that routine delivery. And I'll give you one example. Many of you will be working on sepsis and the Sepsis 6. Across the Royal Free, there have been step changes in outcomes. That's what it's about. But the really important thing for here is how that's been done. So it's been done by supporting staff to learn from each other, to discover how in their context they can reliably do the steps that are needed for patients to get best outcomes. And this has been a crucial part, actually, of building one trust across the Royal Free, and indeed our buddying work with Basildon, where clinicians from the Royal Free were based at Basildon, and a very rich two-way learning dialogue, and indeed wider partnership work across UCLP. So at the heart of the Royal Free Way is this skills and attitudes and belief of frontline staff. You know, frankly, what does being a good professional look like? What do I come to work to do? And our staff are now going through a programme, again initially from Basildon, on specifying the ways that they should go about designing and delivering care. So it's about better value, reducing waste. The consequences of that range from rework and inefficiencies to harm to patients. That's what the best systems do, and that's what we're about. Thank you.
Thank you. Questions for Royal Free? We've got a question over there.
Hello, I'm Esther Crawley, I'm a clinician. Both your presentation and the previous presentation did sound amazing in terms of what you're already achieving. And I just wondered what would happen if you didn't get the Vanguard bid. Would all the work carry on as you're already doing?
So what we're aiming to do with the group model is actually to develop three broad offerings. So at one end of the range, you have the full ownership offering, which is currently what we call today an acquisition. Right at the other end is buddying. And there's the sort of buddying that we've done with Claire and colleagues in Basildon and Thurrock, which was frankly light touch. I thought the hospital was in very, very, very good shape, and we learnt a lot from Basildon. And then in the middle, what we want to do is have an offering where people can join if they want to. So they could avail themselves of the pathology organisation, they could avail themselves of some of the service improvement models. So we think we will do it anyway. But what we think being part of the Vanguard process gives us is firstly an opportunity to learn with others. And we've heard from both Salford and Northumberland about how we can really operate, I think, at pace if you learn with others. And secondly, there are some issues that we're grappling with which we think are difficult. So one example I'd use that we would like some help and support around is to ensure if you are running multiple sites that you have a regulatory system which is proportionate and actually really does add value to the patient rather than a blanket approach across a group. So for us, there are real benefits of being part of the Vanguard process.
Thank you. We've got a question over there at the back.
Good morning. My name is Trevor Clower. I'm an unpaid carer and a patient representative for NHS England from Nottingham. What is not clear is the carer involvement and what lengths you go to it. I've been listening to all the presentations up to now, and I'm listening for words for systems that's in place where you can get the patient's carer involved. like the triangle of trust. That's most trusts try the triangle of care. Most trusts have signed up to triangle of care, and it's in place, and it's been there for 2.5, nearly 3 years now. And it's all about valuing the carer and seeing the carer as a resource. And that's not been obvious on any of the presentations, as I can see at the moment. And it's that important, it's that important workforce that's actually out there. The unpaid carer is an actual resource, not somebody that wants pass it on to another, care organisation or something like that. They actually need to be recognised as such, as in the triangle of care.
Okay, thank you very much for that. I'll pass over to Dr. Wolfson, actually.
Thanks very much. That's just a great question. Thank you very much indeed for asking it. On the one hand, we've got the FFT results, to which, of course, we respond and review our services. But within the services that we've been involved in the transformation of, particularly, for example, the renal network, the dialysis and transplantation and so forth, we have a fantastically active Kidney Patients Association, both a local one and a national one, with whom we worked really closely over the years in order to develop services. Within our London Cancer bid for renal cancer services, London Cancer is very focused as an organisation and having patient involvement. We had a lot of patient involvement and continue to do so in our service development. We couldn't be doing it without them. There's just no question of it.
Now the question from the lady here.
Yes, thank you. You're a guest from representing Royal College of Physicians and one of the medical societies, and I was interested in your work on infliximab. So I just wanted to probe a little bit more on that in terms of international best practice with regards to medicines management in infliximab. So I'd be very interested in how you've used that to inform your work.
I'm really hoping that somebody on this panel can go into the detail answering that question. But I've just got this sneaking suspicion that might be one that's best taken outside of the room. That's a team. I see that.
Do we have time for one more question? Lady at the front here.
Hi, I'm Helen Crump from the Nuffield Trust. I was interested in what you were describing around your very high-performing process that you have in place already, and I wondered what your thinking was around how you might continue to kind of bring out innovation from your staff across multi-sites if you were operating a more standardised approach.
Do you want to pick up on that, James?
So, in the clinical arena and outside the clinical arena, we believe it's the people who are doing the job that understand what the job involves, that are closest to the patient or customer, and they have the ideas. And the task of people who are more remote is to find ways of bringing them together and giving them systems in which that can be done reliably. So we are forever bringing people into the same room, creating dialogues, trying to do that through all sorts of innovative ways. But believe it, they have the answers, and our job is simply to unleash and unlock that within a framework.
Thank you very much. We'll leave it there. Many thanks to the Royal Free.